is Dr. Stafford Broumand from Manhattan here in New York City. And we are doing a no spin live with very famous surgeons, Bill Adams from Dallas, Texas, who is the man and the gentleman behind Plastic Surgery Channel. And he is a thought leader in the space of plastic surgery. And we've got Bruce Van Natta from Indianapolis, Indiana, also major thought leader and accomplished plastic surgeon, a Midwest colleague. And we're going to do a no spin live talking about why plastic surgery is the center of the universe these days. We are busy. And why are we busy? We're busy because people are looking at themselves as we are right now on a Zoom conference call. And generally, when you are talking to someone, you're not looking at your picture. You're looking at the other person. So here we get to look at our faces and we say, what is wrong? What can we do better? And that's where we at Plastic Surgery Channel, and that's where Bill and Bruce and I come in to try to help people who are concerned about the way they look, trying to look youthful and relevant. Let me pass it off to Bill, see what he has to say, see if he can add anything to that, and we'll go from there.
Well, thanks so much, Stafford. And I wore my Texas Rangers cap for you today because I know that despite, I know it's maybe not your first team that you're a fan of, but I know it's one of your teams that you like. So I wore the hat for you.
Thank you.
And it's great to see you, by the way. But I totally agree with what you said. I think that there's a lot of different things, whether people are looking at themselves on Zoom or they have more time to just contemplate kind of their well-being and working out and all these different things. And I think the other thing that we've seen, especially over the summer, it tends to be, we have a seasonal specialty, I would call it, and there's different times of the year that people tend to be busier. And actually, depending on certain plastic surgeons' kind of expertise or what they typically do, sometimes they'll be busier at different times of the year. But I think many of us saw a much busier summer than we typically do. And I think one reason for that is people weren't traveling on vacation as much. Sometimes they typically go on vacation and then they may have some more disposable income because they didn't spend it on the vacation that they were thinking about going on, which is unfortunate. But yeah, we've seen a lot of that. And so I don't know, Bruce, what you saw, but we especially in August and September, we tend to be relatively more quiet than other parts of the year. And that wasn't the case this year at all.
No, I completely agree. And every one of our colleagues I've talked to around the country is experiencing the same thing. From May 1 to August 8th, a year ago, we did 77 surgeries. This year, 120. So that was a 60% increase within that 3-month interval. And, I'm coming in on days I normally don't work, doing extra surgery. And it's a good problem to have. You don't want to sound like a whiner, but it's crazy busy. And my next available appointment sometime in February to get on the surgery schedule. So it doesn't seem like it's slowing down at all.
So as I've been saying, we are here to help. And it runs the gambit of what we can do and the reason why they come to us. And even though COVID started and we were shut down, and for you, Bruce, you could start in May, we could start in June. And I don't really know how it was in Texas, but it was around those summer months. But throughout that time, I believe my colleagues considered ourselves essential workers. So it's tough to say, is it essential that they need to have a breast reconstruction for breast cancer, or are they mentally anguished or subacutely depressed because they haven't had this thing treated and they need something done? So it's part psychiatry and it's part plastic surgery, and we get to offer that. So we run the range of offering our patients something that to them is necessary and that we can then deliver for them.
Yeah, I think that there's a lot more to it than maybe meets the eye superficially, because you're right, Stafford, and that's been shown in multiple studies, the positive psychological benefit and the improvement in quality of life. A lot of these procedures, including non-reconstructive procedures. I mean, for sure, things like breast reconstruction and other types of reconstruction have huge positive impacts on patients' lives, but also the more aesthetic procedures. And, you know, in this era, I mean, in 2020, people need something to feel good about. And
yeah, no doubt.
And so
no
I
doubt.
do think, I mean, it's, you know, I'm sure there's going to be some people watching this that can't understand that, but the truth is that's what the data shows, and that's what we see in our patients. And if somebody's having like the worst, you know, year of their entire life, and a lot of other things are going poorly, sometimes some of the things that we're able to do is just able to give them, you know, a little bit of a glimmer of positivity in otherwise negative year.
And I do know that, Bruce, in your area in Indianapolis, I know you do other things besides surgery. You have fillers and skin treatments and Botox. And I was just wondering what you see, and I'm sure parallels what I see, but just to get your impression on what the non-invasive procedures are that you're offering and are doing these days.
The demand for that is increasing, and I'll tell you what, we've just acquired some of the new devices. I think it's really exciting, some of the things that are out there for skin tightening, fat reduction, resurfacing, some of these micro needling procedures that you can do that can really make a difference for people. We're seeing demand for that as well.
Well, again, we never really know where is the sweet spot. We just are here to help our patients, and fortunately, we get to practice our trade and help people at the same time. And it's a difficult, troubling era that we still don't know where it's going to end and how it's going to end, but we're here to help. And as plastic surgeons, I think we have the ability to fit that niche. And with the new technologies and new concerns, we will grow with that and move with that. I just want to get some maybe final words from you, Bill and Bruce, and just to let our viewers know, and let them know that they can follow up with the Plastic Surgery Channel and get more and better information from the thought leaders and practicing plastic surgeons throughout the United States.
Yeah, I think it's been a great discussion, Stafford, and I think you did a great job summarizing. You know, the only thing I would just tag along on is that now, you know, we are seeing some more positivity in terms of the COVID situation. There's clearly, you know, some established treatments now. There's some evolving treatments. There's some vaccines, obviously, that just even as of today, were very good positive news coming out. So I think that we anticipate in plastic surgery that this, the current situation will continue on, because as people become more comfortable, I think that they're going to be, you know, they're going to think, hey, I'm going to get to go on vacation this summer. And so there's going to be more people wanting to come in and see their plastic surgeon for non-surgical treatments and surgical treatments. And so, you know, as you said, we're here to help.
I would echo all those comments, and I think it's a situation where people, a lot of things are crazy. They feel like they can't control too much. Maybe here's something they can feel good about themselves, and it's nice for us to be in a position to be able to help them. So hopefully we'll have this thing under control sooner than later. We're all tired of it, and but until then, if people need a little help, we're here for them.
Well, thank you, Bruce. Thank you, Bill. This is No Spin Live, Plastic Surgery Channel. If you have any further questions, please pull us up. We're there, available, and ready and willing to help.